الدكتور أحمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم والوجه والفكين. محاضرتنا لهذا اليوم سوف تكون dental management of patient with thyroid gland disorders. First of all, let us give some idea about the anatomy and physiology of the thyroid gland. Thyroid gland actually situated in the anterior region of the neck against the cervical vertebrae 5, 6, 7 and the first thoracic vertebrae T1. Actually, thyroid gland consists of two lobes, the right and left lobes. These lobes connected together by an isthmus, which is situated behind the thyroid cartilage. There is another loop which is called pyramidal loop. So there are three loops, right, left, and the pyramidal loops. Actually, thyroid gland is one of the endocrine glands, and this gland secretes hormones, and these hormones, as we can see here, these are triiodothyronine, thyroxine, and calcitonin. These three hormones are very important for the regulation of the metabolism of carbohydrate, lipid, and proteins, as well as for O2 consumption. So these are very important for regulation of the metabolism as well as for O2 consumption. The secretion of these hormones can be controlled by what we call a negative feedback mechanism, which is controlled by the pituitary, by the hypothalamus pituitary thyroid axis, as we can see in this diagram. So sometimes there is disturbances in the secretion of this hormone or these hormones. Sometimes there is an increase or decrease in the secretion of these hormones. And actually, the disturbances in the secretion of these hormones may affect the body organs, maybe affect the heart, stomach, nervous system, and so on, even skin. So, in case of an increase in the secretion of the thyroid gland, this is called hyperthyroidism, in which a case called thyrotoxicosis. And one of the causes of thyrotoxicosis is a disease called Graves' disease. So what are the manifestation, or what are the clinical manifestation of this disease, what we call hyperthyroidism or thyrotoxicosis? We can see that the patient may lose weight because there is an increase in the metabolism of lipid, carbohydrate, and proteins. Also, an increased appetite, intolerance to or heat intolerance, increased palpitation or tachycardia, profuse sweating, and hyperdefecation. Also, there is goiter, or what we call the swelling of thyroid gland. The swelling of thyroid gland, it is called goiter. This goiter, there are two types, either functional or non-functional. So goiter also one of the clinical manifestation of hyperthyroidism. Also, the patient may complain of fine hairs. Even there is tremors, finger tremors during stretching. There is tremor during stretching of the fingers. Confusion, nervousness, lid lock, and also the most pathognomonic feature of the Graves' disease is exophthalmos, because of the lipid deposition or deposed tissue behind the eyeball. So in case of hypothyroidism, which is decrease in the secretion of the hormones mentioned previously or decrease in the activity of the thyroid gland, this is called mixed edema. Actually, hypothyroidism may occur during adulthood, and in this case it is called mixed edema. But sometimes also it may occur during childhood, and in this case it is called cretinism. Hypothyroidism could be congenital, could be acquired. So what are the clinical manifestations of patient with hypothyroidism? It is the opposite to that of the to the hyperthyroidism. So the patient complained of weight gain, fatigability, cold intolerance, constipation because of the decrease in the bowel mobility, and also sad or crying face. Also cold clammy skin, goiter also could be seen in case of the hypothyroidism, tibial edema, and hoarseness. That means the voice become too rough. So this is the clinical manifestation of patient with hypothyroidism. So why hyper or hypothyroidism important for dentists? Actually, because as I mentioned before, clinical examination of the examination of the thyroid gland, it is one of the region included within the head and neck. So examination of the head and neck included the thyroid gland examination. Sometimes also remnant of thyroid gland may be found in the posterior third of the tongue. So for this reason, this is important. In addition to that, there are some dental procedure may affecting the disease, may aggravate the disease or exaggerate the disease. For example, dental manipulation, dental and oral surgery, oral and dental infection, and also the vasoconstrictor and the local anesthesia. All of these conditions or all of these factors or agents may affecting the disease, may exaggerate or aggravate the condition. Now, how we can manage patient with hyperthyroidism, patient with Graves' disease or thyroxic. How we can manage those patients? In this case, first of all, for non-diagnosed patient, this patient comes to dental clinic, complain from certain sign and symptom. So from the sign and symptom mentioned previously, we can detect the patient with thyroid. So if the patient comes to dental clinic complaining of certain sign and symptom, in this case, we have to refer for medical evaluation and treatment. For diagnosed patient, the patient or those patients who already diagnosed, that means the patient visit dentist, visit the physician and take their treatment. So in this case, first of all, we have to determine the initial diagnosis. When was the first time that the condition diagnosed? Also, we have to know the past and the present medications, because the patient with thyroid gland, for example, in case of thyroxic hyperthyroidism, may take anti-thyroid. In addition to that, due to palpitation, which is one of the manifestations of patient with thyroxic, the patient may take also beta blockers. So in this case, we have to know the past and present medication. Also, we have to check the patient status, sign and symptom, and also thyroid function test. Thyroid function test we can measure through laboratory test, measure the level of T3, T3 or T4 in the blood. Also, the thyroid can be assessed by sonography or by scanning. So this is what we call thyroid function test. Any patient with sign and symptom mentioned previously, for example, palpitation, weight loss, hyperdefecation, profuse sweating, heat intolerance, should be referred to a physician for medical re-evaluation, because the patient may stop taking the drug. So in this case, the sign and symptom happen again. So in this case, we have to refer the patient for medical evaluation, for re-evaluation. Although the patient is, or although the patient was diagnosed with thyroxic, but we have to re-evaluate the patient because the sign and symptom occurred again. Also, before treatment of patient, any patient with thyroxic, we have to consult with patient physician whether the patient under treatment or stop treatment or even non-diagnosed. Any patient with thyroxic should be the physician of the patient should be consulted before dental treatment. We have to avoid the following. As I mentioned before, certain dental factors, for example, infection or oral procedure or dental manipulation may affect the condition. I mean thyroxic, may aggravate the condition, may exaggerate the condition. For example, we have to avoid catecholamine, adrenaline, and noradrenaline in the local anesthesia. which used as vasoconstrictor, or even in the gingival retraction cord, because this may aggravate the condition, increase palpitation. Also, oral and dental infections should be avoided, and surgical operation. All of these may increase the secretion of catecholamine, and this will lead to aggravate or exaggerate the condition. Now suppose that the patient develops thyroxic crisis, which is fatal condition or risky condition, during dental manipulation or during dental procedure. So what we can do in this case, how we can manage this patient. Actually, thyroxic crisis, this is one of the risky actually. The patient usually complains of profuse sweating, increase in the body temperature, hypotension, nausea, vomiting, and sometimes coma. So in this case, how we can manage this patient during dental procedure? First of all, we have to ask medical assistance. Then we can use wet packs and ice packs, because the patient complains of heat intolerance, so we have to use ice bags. Also, we can give the patient 100 to 300 milligram hydrocortisone intravenously or intramuscularly. We can give the patient IV glucose, and also we can start cardiopulmonary resuscitation. So, patient with good medical treatment, if the patient visits his or her physician and taking his drug regularly, so in this case, first of all, we have to treat acute and chronic infection, as we mentioned before, because the infection may aggravate or exaggerate the condition. And if there is no acute or chronic infection, we can give the normal dental procedure can be given to the patient. So this is the dental management of patient with thyrotoxicosis, Graves' disease in general, and also for patient who develops thyrotoxic crisis during dental procedure. Now, how we can manage patient with mixed edema coma? That means with patient who have or who complains of hypothyroidism. So in this case also we have to give certain hints in order to manage those patients. So first of all, also we have to ask medical assistance, and also we can give the patient 100 to 300 milligram hydrocortisone IV or IM. Actually, this is to increase the reactivity of the vascular blood vessel to the infection or to the condition actually, and also to start artificial respiration. So the patient with mixed edema can be managed by ask medical assistance, give the patient 100 to 300 milligram hydrocortisone to increase the reactivity of the blood vessel to the condition, and also to start artificial respiration. So this is the end of the lecture, and thank you for your attention.